welcome everyone. We're so glad you're here. Dr. Alvarez is the oldest of 10 siblings, something which has shaped the way that she approaches every aspect of her working life. She was born in Puerto Rico. She completed a medical school with honors, becoming a member of the Alpha Omega Alpha Honor Medical Society Gamma Chapter. Her membership of such a prestigious professional medical organization was recognized for continued excellence in scholarship and her demonstration of the highest ideas in the profession of medicine. It's a passion for her work that she still has today. She has written a book titled Heels and Ties, and we have them on sale in the back of the room this evening if anybody's interested. And she just told me that she is going to publish a new book in the fall, which will be very interesting. And that, I believe, is on the gut and eating properly and knowing their foods. She is the co-founder of the Tri-County Heart Institute. She lives and practices with her philosophy of treating her patients as her family. And I can attest to that. She is absolutely wonderful. I am a patient of hers. My husband is a patient of hers. And we love her. Welcome, Dr. Alvarez.
Thank you. I have a good tone of voice. You can all hear me? Mm-hmm. I'm just going to be moving a little bit because I had to work with the computer, but do you prefer? Hold on. I want to give a test here. Because I know that sometimes we have. Can you hear me well? Yeah. Does it make a big difference? The other ones don't. Oh, because they are recording me. Probably you want me to be on the microphone. Yes, it is.
That one is cordless.
Okay, so yeah, but I prefer not to touch it. Okay, so thank you for having me here. And as a cardiologist in the community, I have been actually in the community for the last 10 years. I finished my fellowship in New York and then moved to Florida. My family is still in Puerto Rico. My parents are still in Puerto Rico. Most of my siblings are still in Puerto Rico, and they're happy because I'm not bossing them around anymore. I'm the oldest of the 10 siblings now. In terms of cardiology, tonight what to expect is I have a passion for preventive cardiologists, and I think this is actually the perfect group to have a conversation about it. No, I feel that I'm a firm believer that if you have a condition that kills almost 500,000 women every year, and I said 500,000 women every year because I have a passion for cardiac disease in women and prevention and identification on time, because even though I know that I have a few of the men in this room tonight, most, if not all, that we know about cardiac disease was tested or studied in men. So when I wrote the book Heels versus Ties, most of my men came to the office and said, and what about us? Because Heels versus Ties is all about understanding that women are not little men, that our risk factors are different, that we present different, that there's some things that if you're not aware of, then, and your doctor is not aware of, then you're gonna be missed, and you're gonna become another statistics. And because of that, I wrote this book. This book was intended to educate women, all different levels of education about their risk factor for heart disease, for them to know that is their number one killer, is their number one health threat, and then save as many lives as we can. So if you, my answer to them is always been, I know everything about you because everything was tested on man, and we know all. So everything that we apply this day in medicine, most of it is actually all that we know, research that was done in man. So we're gonna be talking about some of those differences, and then I'm gonna open a moment to talk about preventive cardiology and what can we do to avoid being a statistic for a condition that is preventable 80% of the time. Okay, so we're gonna start with a short video that I want you to watch for me. It's in Dutch, but there's a subtitle in English. Sure. Do we have any Dutch person here? On my last audience I had, so Larry. Okay, so I'm gonna just end this.
In deze studio hebben we vandaag diverse actrices uitgenodigd om een rol te spelen in een video voor de Hartstichting. Hier achter de balie komt straks Linda te zitten. Zij gaat de actrices ontvangen. Wat die actrices niet weten, is dat Linda een hartinfarct heeft gehad. En in het complot zit.
Hey, hallo, goedemiddag. Linda. Hi. Mag je cake nemen? Oh nee, dat moet niet meer.
Ja.
Nee, misschien nog een macinaten erbij.
Oh nee, gaat goed hoor.
Ja, oké.
Kijk, kom maar binnenlopen. Zou je mij kunnen vertellen wie je bent?
Ik ben Marianne van Reken. Ik ben Tanja Jes.
Ik ben Lieke van Lexmond.
Zou je me kunnen vertellen hoe jij denkt dat een hartinfarct eruit ziet?
Wat zeg je?
Hoe een hartaanval gaat. Ik denk dat het een
Kramp in de hartstreek of druk op de hartstreek.
beetje dit gevoel.
Zou je mij kunnen laten zien hoe dat eruit ziet?
Zoiets.
Stop maar even, wat van jezelf van?
Nou, ik denk niet dat dit het helemaal is.
Misschien wordt het heftiger. Stop hoor. Stop. Hoe voelt het?
Benauwd. Ik denk dat je dit er helemaal niet meer doet eigenlijk.
Het zijn steken.
Stop maar. Je hebt nu uitgebeeld hoe de meeste mensen denken dat een hartinfarct eruit ziet. Zou je even naar dit filmpje kunnen kijken?
Mijn naam is Linda Maasgeer, ik ben 53 jaar oud en ik heb een hartinfarct gehad. Een jaar voordat ben ik met maagklachten, wat ik dacht maagklachten, naar de huisarts gegaan. En die heeft mij toen maagtabletten gegeven, maar de pijn werd op een gegeven moment zo erg. Toch denk je, je gelooft de huisarts. Ik ben na een week ziek geweest te zijn weer gaan werken. Op een gegeven moment ging het gewoon niet meer. Ik ben maar gaan liggen. Ik heb een vuilnisbak eigenlijk gepakt, omdat ik zo misselijk was. En in mijn achterhoofd was ik nog steeds bezig met mijn maagklachten. Ik heb een maagklachten. En toen hebben ze 112 gebeld. De gillende sirenes naar het ziekenhuis. Ja, ergens op de achtergrond heb ik gehoord dat het een hartinfarct was. Sorry. Ik ben een besefje nemen. Maar ik ben er nog. Dat is... Dus wat dat betreft ben ik heel dankbaar dat ik er nog ben. En ik hoop dat er heel veel aan gedaan gaat worden.
And because of that is what I'm here today. About 420,000 women die every year from a heart condition that is preventable because they're not recognized properly. And out of those, 50,000 more women than men die every year. 50,000 more women than men die every year from heart disease. More women, we have more chances of dying from cardiac disease than cancer, but today women worry more about breast cancer or any type of cancer that they do from cardiac diseases. For every woman that died from cancer, 6 died from their heart condition. And we still worry more about cancer than what we do about heart disease. And cardiac disease is preventable 80% of the time. A condition that is preventable 80% of the time still kill about 500,000 women every year. So the reason why I always like to present women in history, it's been a struggle trying to move in politics and, being recognized and good contributors in different areas in our country. But in health, it hasn't been, it's not a difference either. For decades, we still have seen women care as a bikini approach. When we talk about women's health, which actually frustrates me a little bit when people talk about clinics that are meant for women's health, they mean there's a gynecologist in there, and then you get in your mammogram and you get in your pap smears, but they're not taking into consideration the major health threat, which is heart disease. So I'm going to just kind of like, for the sake of give you a good baseline. I know that the majority of you, because you guys are all into health, you probably understand some of the components of what a cardiac disease is, because it's a big basket. When I talk about cardiac disease, we mean there is cardiac for heart, vascular for vessels. So when we said there is a cardiovascular condition or cardiovascular specialist, is because we work with the heart and the vessels. So there's different type of problems. In the left corner, you can see where I show is coronary artery disease. It's the most common type of heart disease. That is the blockages in the arteries of your heart. The disease that can give you a heart attack, and that is the most common. But also part of the cardiovascular problems is when the vessels that goes to other parts of your body are also sick. And that will be peripheral arterial disease, when you have problems with your legs, when they burn or cramp when you exercise, you have blockages in there. Sometimes the doctor ended up putting stents to be able to facilitate your life. And then other components of heart disease include heart failure, the heart inability to pump. More often than not, when we think about heart failure, we think about an enlarged heart, a heart that doesn't pump correctly. But women tend to suffer more from diastolic heart failure, which is the heart doesn't relax properly. So this is gonna be kind of like very interesting for us to discuss, because you might be suffering from heart failure. The most common presentation will be shortness of breath, swelling, weight gain. Your doctor do an ultrasound of your heart. The pump seems okay. They tell you that your heart looks okay, but do they mention anything about the diastolic function, the ability of that heart from relaxing? So that's one of the major differences, that even though between men and women, we can both have systolic heart failure, women, for some specific reasons that we're gonna discuss in a few minutes, tend to suffer more from diastolic heart failure, which is the inability of the heart from pumping blood. And then also part of the heart diseases include arrhythmias. And although atrial fibrillation is one of the most common arrhythmias, arrhythmias is another basket that covers a lot of rhythm disturbances. More often than not, the arrhythmias will present as a flutter feeling in your chest, palpitations. Sometimes I feel that my heart skip beats. So all of that is part of the electrical system of the heart that is sending you a warning that something is not right. So now, going back to coronary artery disease, which is the most common form of cardiac disease. The most common form, coronaries are the little vessels that goes to your heart and feed the heart. So basically, what I want you to think about is this. When we think about how does the organs receive their blood, and how do they receive their oxygen and nutrients, that we worry so much about when Linda mentioned, what you eat is so important. Well, somehow those nutrients had to get to your organs, to your body to feed itself. So those are called arteries. It's like a little tubing, plumbing, going to the entire body. So the heart has its own tubing, and that is called coronary circulation. So when your coronaries start getting this gunk build up inside those arteries, which is a combination of a lot of factors. This is the perfect community to talk about. We know that cholesterol is not the only problem why patients develop plaque in their arteries. It's a combination of inflammation. There's other factors that go beyond your LDL and your HDL and your triglycerides numbers. But the most common cause of heart attack is plaque obstructing the flow in your arteries. But in women that present with heart attack to the hospital, when they undergo a heart cath, they're more likely not to show plaque that is obstructing the flow. And for many years, it was unknown and a mystery for many, why are they presenting with a heart attack if they don't have blockages? And it's because the system is different, and that's why we present different. So in our case, it's more of a spasm problem.
There you go.
Here we go, baby. I'm glad that I have you here. A spasm. So in women, we tend to have more of a spastic problem. The arteries constrict very hardly and then relax. And when they do that constriction, they're basically causing an obstruction on the flow to the heart that can cause a heart attack. And I don't know, you have heard a term called broken heart syndrome. Somebody that had a very, very strong pain because they lost somebody that they loved too much, or something happened to them that ended up having a heart attack, and they went to the hospital and they did a heart cath and they couldn't find that they have blockages. but they're called broken heart syndrome or Takotsubo syndrome. This is the mechanism for that, it's spastic. So whenever the doctor goes in and look into your arteries and they don't find disease, that doesn't mean that you don't have a condition, it's just a different condition. But we're so used to just look for plaques. So in my book, I mentioned, like, I think at least 7 times, I said, a normal coronary angiogram doesn't mean that you don't have coronary artery disease, because there's different mechanism for us. And then in addition to that, there's a second mechanism for women that we call microvascular angina or microvascular disease. So if I have you imagine the circulation to the heart is more of a tree. What we see, the coronary arteries are like a trunk. And then there's branches that come out of that trunk, and there are more branches and branches and branches until we get the little tiny branches in the top of the tree. So the same happened with roots, no? You see the trunk and then you see the roots. So that's what happened with our arteries. They are not just one tube, there are tubing coming out of them. So there's like little branches that keep stretching around the heart and inside the heart to feed the heart. And as we age, those arteries don't function as well. And that has to do with our changing hormones. Estrogen is one of those hormones that we all know. Everybody that is here, I'm pretty sure, well, no. We have somebody that hasn't been gone through menopause yet. So, but for the majority of us, we know that. So when those changes in menopause start happening, is because there's a hormone that is going much lower in our system, part of the hormones, because estrogen is one of them. And then so it causes the microvasculature to dysfunction. And now those vessels don't relax properly, and they also go into spasm, causing symptoms similar to like when you're having a heart attack, but when they go and look, you don't have that disease because you don't have plaque. So then it's up to you to know that there's other mechanism, because if you are not your own advocate and your doctor don't happen to know this, then you're gonna continue suffering from this problem until you end up with a heart attack, and this was the mechanism. Let me see if I remember how to move this. Okay, so then now, when I said risk factors for heart disease, there is a lot of risk factors that we share with men, you know, and we're gonna go over some of them. But how much do you know about your risk factors? You know, women in general have other risk factors that men don't have to go through, because, for example, pregnancy is a stress test to the heart. Pregnancy alone creates a lot of stress in our heart. The heart now has to pump extra blood, more liters of blood, because now we have a baby growing and inside us, and that alone is a stress. But if you have developed a condition during your pregnancy, like gestational diabetes, if you were diagnosed with diabetes during any of your pregnancies, or if a woman had developed hypertension or preeclampsia or eclampsia during their pregnancy, that alone increases the risk for heart disease in the future. Even if the sugar get corrected, and even if the blood pressure get corrected, that is a lifetime risk. There's always gonna be a risk for developing cardiac disease, and that's why they have to be a little more proactive in prevention and trying to look for things that they can do to eliminate some of the other risk factors. Now, menopause is alone. That's why, although the risk for heart disease increase at the age of 45. So as soon as a man turns 45, we are very paying attention to them, because we know the risk increases after that age. For a woman, it's 55. So we had that 10-year period because of the hormones. Once we pass our menopause, then now we're basically at the same risk as men, plus the additional risk that we're gonna go through some of them. So when we think about menopause, you know, does anybody know what is 10 times worse than a woman in menopause? Does anybody can take a guess?
Woman in labor.
One in labor.
It's actually 2 women in menopause. I know that the husbands here can relate to this. They're like, Lord, you tell me menopause. But menopause goes beyond the hot flashes and the weight gain. You know, there's a lot more involved when we talk about menopause. So one important event that happened in menopause is the drop in the estrogen hormone. Estrogen helps our body produce nitric oxide, which is our natural vasodilator. It's our natural nitroglycerin. That's what I always tell my patients. You know, nitric oxide is and especially for you guys, I know that many of you probably know, is a great supplement. Beetroot powder is rich in nitric oxide. There's a few natural foods that we can have to increase our levels of nitric oxide. But when we're young, we don't have to worry about that because our body is producing it. Estrogen is amazing helping us produce nitric oxide. So when it goes down, estrogen levels make our blood pressure go up. So that is the explanation to why, even when you always have normal blood pressure, all of a sudden your blood pressure is high. You know, I get this as a cardiovascular specialist, I get this a lot when patients come to me and they don't understand why. Like my blood pressure is always good and now it's not. And I said 3 out of 4 women postmenopausal will have high blood pressure, and it's because of the changes in hormones. And so it is what it is. And then we have to work with some of the other lifestyle that we can work on, reducing the sodium intake, exercising more to see if we can control that blood pressure. But it's just the nature of aging for us. You know, the hormones will cause that. Then as the estrogen levels go down, our weight goes up. And that explains why the fat belly and why it's so hard to lose weight as we age. When we were young, we were able to eat whatever we can, and then it's the power of the metabolism and how does that change. And then now also the sugar management, the body doesn't manage the sugar properly. Now, problems with sugar, which can be prediabetes or diabetes alone, increases your risk for heart disease for many reasons. So diabetes, we're gonna go in a second to that, but if changes in hormones alone make your body not manage sugar properly, then there's another risk that we carry that men won't because they don't go through menopause. And then as the estrogen level comes down and we go through menopause, then we will have a tendency to have more sticky blood. The blood components tend to stick more, so we can form clots easier, which also increase our risk for a heart attack. So when these are the most common risk factors for heart disease, that goes for men and goes for women. There's only a few things that I'm going to call your attention when it's more specific for women. But for example, I put here 55 plus years. I already told you age is a risk factor, a little different for men than for women. Obesity is a risk factor. And the reason is because obesity carries along with that other problems. No, so that will be high blood pressure, you tend to be more sedentary, your sugar levels go up, your cholesterol numbers go up. So it's not just the overweight, as it is what are the consequences of being overweight. Because you can have somebody that has a little extra pounds, but they have normal blood pressure, normal sugar, so then we can work with that. But if you are overweight, your doctor is probably gonna be mentioning to you, we gotta lose some weight, it's because of the potential other cumulative risk factors that are gonna be added to your list to develop heart disease. And then what can you do about it? Then there's many things that we can do. And then part of it is, that's the reason why I'm writing the second book that is coming now in the fall, because we all know there's so much information about food. And as a provider, there's no day that passes that somebody come to my office and said, do you have any diet that you recommend? Or is there anything specific that you suggest that I will eat? Or somebody after a heart attack asking, what should I eat? And I know it's not because of lack of information. There's tons of information, you guys know. There's books and books and books and a lot of material about diet, keto diet, paleo diet, this diet, the other diet, eat this, eat that. And I feel that if at least I can facilitate understanding eating, you know, and then kind of like, what is food? And the simple aspect of what is it and how your body uses it, then we can help you lose some weight. Because weight loss shouldn't be as problematic as it is, although I realize that it's more complex than just what you eat. You know, as I just explained to you, that hormone changes is one of the major reasons why we start gaining weight. So if you have an imbalance of hormones in your body, your doctor might want to work with you first on balancing those hormones and then working on food and diet. Okay, so family history is a risk factor for heart disease. Once we pass certain age, I'm not gonna say what age that is now. Now, once we pass certain age, you know, family history is really not that relevant because we're already old and we're already at risk for heart disease. But if you have a very strong family history for heart disease, and when we talk about family history, we talk about immediate family. So that is mom, dad, siblings, no? So if you have a mother that had a heart attack or any heart problem before the age of 65, before the age of 65, that increases your risk. The same if you have a sister that had a heart problem before the age of 65, that increases your risk. If you have a brother or dad that have a heart problem before the age of 55, that is considered premature coronary artery disease, and that increases your risk. Because that tells you that there is a component of genetics. And I know that sometimes our family members not necessarily are following a similar lifestyle that we're following, no? Sometimes we say, well, they were diabetic, or they smoke, and they did all these things that I don't do. So then that's awesome, because you are eliminating a lot of risk factors from your list. But if they have premature disease, there's something else beyond their lifestyle that perhaps will also contribute in there. So I want you to count that as kind of like part of your gene. So if you're older than 55, you put a point. So you can do your math in your head. If you are obese, or your doctor had tell you, your BMI is above 25, we had to lose some weight, then you get a point. If you have a family member with any of the specific that I just gave you, then you get a point. And then cigarettes. The reason why cigarettes are addictive because they relax people. Nicotine goes to a receptor in the brain that causes relaxation. 14 out of 100 female smoke. So I wish that nobody will smoke, but there's a reason why people smoke. It's addictive, and the nicotine causes relaxation. But now, there's so much more damage that nicotine can cause in the system. So when we said don't smoke, and I want to just add this piece of information for you, because you hear that we talk about smoking as a risk factor for heart disease, but you're like, why? So well, first, it causes inflammation in the body. And anything that causes inflammation, when you have an infection or you scratch your skin and it gets inflamed, it gets red and hurts, that is happening inside your body when you're smoking. So basically what it causes is the vessels to be very, very, very irritable. And then so clots can form around there spontaneously. So that's what we said to a smoker, that even when their tests look okay, they can have a heart attack at any time because clots can form at any time. Then cigarettes also makes your arteries get stiffer, which makes them be more calcified and more plaque forming in there. And at the same time also can raise your blood pressure, because when you're causing inflammation in your body, or when you're smoking and the oxygen and the CO2 levels are not well properly balanced, your body tends to constrict the vessels, and then that raises your blood pressure. So that's kind of like part of why cigarettes causes so much damage. And that is without talking about the consequences to your lungs and other things. So if you smoke, then that's a point for you. If you smoke but you quit 10 years ago or longer, then it doesn't count as a risk factor for heart disease anymore. The lung damage is there. Whatever your lungs suffer, that doesn't go away. But your heart, yes. So if you quit longer than 10 years ago, then we don't count that as a risk factor for you anymore, because then your heart hasn't been exposed to cigarettes for a long time. And then diabetes, high sugar in your body, just think about honey running inside your vessels. I know that it's not necessarily like that, but that's what's happening. It's sticky. So then it sticks around the vessels and then promote plaque formation. Diabetes also causes inflammation. And then I just explained to you how an inflamed vessel looks like. It's red and it's irritated. So if you are diabetic, then you have 2 times more chance of having a heart attack than somebody that is not diabetic. So that's why we treat our diabetic patients like they already have coronary artery disease. We treat them like that because we want to be very aggressive with those patients, because we know they are much higher risk of having cardiac problems. Okay, so if you have high blood pressure, hypertension, the guideline changed a few years ago. Hypertension now is anything above 130/80. So your blood pressure is greater than 130/80, then you are hypertensive. So what happens if your readings are high at the doctor's office but not at home? Then you have white coat syndrome, and that is okay. That's why there's a syndrome for that. But being in denial about your high blood pressure is not going to help you, because if you have high blood pressure, although there is so many things that we can do naturally to help with that blood pressure, then you have to work with your providers to help you manage properly in a natural way, if it's possible, to drop that blood pressure. What I normally, what can you do naturally to help your blood pressure? Well, we always say weight loss. If you lose 10 pounds, you can drop that blood pressure at least 5 pounds. 5 points, the systolic number. So if you wanted to really, really, really work with your lifestyle, then you gotta put an effort on it. So what can you do if you get diagnosed with high blood pressure and either you don't wanna take medications, or, and I'm gonna put a disclaimer here in a second, or you want to try not to keep adding medication to your list. Because I know that sometimes we say once we get one pill, then it's gonna be another pill, then it's gonna be another pill. And then we said, okay, so what are you doing on your end to prevent that extra pill? Because there's things that we can do so we don't have to add that extra pill. So exercise, significant impact on your blood pressure. Because when you exercise, and when I mean exercise, I mean exercise. I mean, it has to be a moderate activity that you perform for at least 30 minutes a day. Or if you don't have time to do it for 30 minutes, it has to be consecutive. 2 sessions of 15 minutes is okay. We use a minimum of time because it takes a specific amount of time for the heart to start, kind of like the heart start racing, the arteries start relaxing. So if you want to work with your lifestyle as part of prevention of hypertension, then exercise is an amazing one. And then reduction of sodium in your diet. Reduction of salt intake also helps with that blood pressure. And there is so many other natural things that we can do. You know, there's herbs and stuff that we can utilize as long as your doctor knows, especially if you're taking medications. Because as I said to my kids, even water can kill you. So anything in excess, it can be a problem. Because it's garlic doesn't mean that it's okay. You know, if you're mixing garlic with something else and your doctor don't know that, you can end up passing out in the bathtub. So when we said, you make sure that whatever supplement you're gonna take that perhaps might help with that blood pressure, that your doctor knows that you're doing that, or that you consult with somebody. And that as a physician, I know that sometimes patients are a little skeptic in telling their doctor what they take, especially if you don't feel rapport with your doctor, that they're gonna be open to your natural ways, no? And I know that is a challenge. I love natural remedies because I feel that our body has the ability to heal on its own, and anything that we can do to help it is better than any pill that you can put in your body. You know, I love when patients want to do anything but taking pills. And I support that, but I know not everybody does that. But I'm also that doctor that if I feel that no, we cannot afford to have you on supplements only. We gotta work with this, and once you get me here, then we can start working with your supplements, because you don't never wanna risk your life over, you know, being insistent that you wanna be all holistic. And I'm all for all holistic, but sometimes we wait too long to be all holistic, you know, and then we have to work with our diet and everything else. So it's never too late, but if you're gonna decide that that's the approach that you wanna take, then you gotta make sure that you have a doctor that support you with that and that is willing to work with you. Okay, so cholesterol is necessary for our normal function. You know, I know cholesterol is overrated. You hear a lot about, you know, how cholesterol is bad, and then we say, well, cholesterol is not all bad. You need cholesterol. We need bad and good cholesterol. The LDL, I call it the lousy cholesterol in my book, because L for lousy is easy to remember, no? So we said the L is the lousy, is the bad one. LDL is needed for hormone production, no? Testosterone and estrogen. We need LDL for our brain function. The membranes of all the cells in our body use cholesterol. So if your cholesterol is too low, it's a problem. But if it's too high, it also becomes a problem too. So it's managing that cholesterol, but normally you want to go beyond the cholesterol. Cholesterol is one risk factor. So if you have 1 out of 10, then that's not too bad. But if you have 1, 2, 3, 4, 5, then it becomes a problem for you. And sedentary life. And then I just mentioned to you, what can you do to eliminate that sedentary life? Now, for the, I have a blog on my page that says, you know, 5 ways of exercising without knowing that you're exercising. And if you don't have time, I know that when we retire, time can like fly. We don't have time for nothing. So have commitment with our friends, we have golf, we have this, we have doctor's appointments. No, our calendars are getting full, and I said, well, what can you do to incorporate exercise? Well, one way is if you're watching TV and there's a commercial, stand up and walk while the show starts again. Or if you have a treadmill or a stationary bike that you can put in front of a TV so that way you can watch your favorite show there, and then it doesn't make you feel that you're exercising, and then you're actually taking advantage of something that entertains you while you're moving. I also mentioned that we can do dancing before shower. That's my favorite one. Dancing before your shower. So you play your favorite music, 1 or 2 songs, and then just go wild in the bathroom. You can do it in the shower, you can do it as you're getting, stuff out and your clothing out. And so what would that be, 8-10 minutes? And then you do that, and then you do that before you shower in the morning, you do that before you shower at night, and then you have a good 20 minutes in there. The point of doing exercise is that has to be something that you enjoy. If it's something that you feel that you're really exercising, then it really makes it a little more cumbersome to complete. And stress. Well, now, actually, before I get to stress, when your doctor is checking your cholesterol numbers, normally, I normally said that what we're looking in general is what we call the tip of the iceberg. Now, a cholesterol number that traditionally your doctor will do is gonna be a generic where you have your LDL, your HDL, your triglycerides. But then you also, I always like to dive in, but of course it's part of my specialty, and try to understand beyond your LDL what other things can be in your system that can increase your risk for cardiac disease. And today we know that there's other markers in your bloodstream that can help us understand if you're at higher risk for having cardiovascular problems. And for the sake of time, I'm not gonna get into them, but I'm gonna mention them. Inflammatory markers, we can measure inflammatory markers. HSCRP is one of them. That way help us to understand if you have a lot of inflammation inside your vessels that can predispose you for plaque formation. And then we measure a little protein called lipoprotein A, which that one is more genetic. And then we measure homocysteine levels. So if you have been diagnosed with cardiac problems and your doctor said your cholesterol is great and everything looks good, they probably want to dive in a little deeper and try to find out what else that they can do, can help you approach your life in a more holistic way to change those. Because more often than not, we change those with diet and supplements, okay? So now, triglycerides are associated with heart disease in women, not in men. So if you have elevated triglycerides and you're a woman, you are at higher risk of having plaque formation in your arteries and having heart disease, but not for men. And then stress, the same thing. Although stress in general affects every human being, there have not been a link of stress and heart disease in men as it is in women. I think stress is not taken very seriously. What causes our body to change when you are stressed, there is what we call this autonomic system in our body, which is the one that makes you digest your food, breathe, your heartbeat without you having to think about it. So then there is a fight or flight. The fight or flight system is called the autonomic system, and that's the one that triggers. So when you're stressed, there's a lot of adrenaline, epinephrine, catecholamines getting released in your bloodstream. When you are in front of a lion that is gonna eat you, that is a good system because it's gonna make you run. But when you're continuously exposed to the stress and it's there, kids, a problem, kids, work, kids, go back to kids, my children, then that becomes a chronic problem. And now your body is continuously secreting adrenaline, catecholamines, and what that does is increases your heart rate, and as the heart is beating faster, put more demand on the heart, makes your arteries get stiffer. Those substances also makes your arteries constrict. And I explained to you at the beginning that one of the mechanisms for heart attack in women is dysfunction of those vessels that they just squeeze too hard. That's why when you are under a lot of stress, you might experience symptoms that feels that you like something's wrong. Like I feel like my chest feels heavy or my jaw hurt. I'm just stressed out. Well, guess what? The stress can give you a heart attack because that's the mechanism. Is those arteries are continuously exposed to that substance that is causing that. And long term, if you're stressed, chronic stress, long term, eventually you're gonna end up with high blood pressure, hardening of the arteries that promotes more plaque formation. So I think that stress is not taken as serious as it should be. And this is a statement for real, for real. real. This is not, I didn't invent this. This was taken from a study that was done with a group of psychologists, and they basically, just to be fair to the man in the audience, basically, what happened is that when we get married, the man, although they, they're there to protect us, but they feel more comfortable. When they're married, kind of like, there's like this, like, I have this family, I have this wife, I had this beautiful family. And for a woman, it's like, we have these kids, we have all this, so then there's like a lot of other tasks that they feel that is like pulling their heads out. So that is actually why that statement was actually there. Because heart disease doesn't discriminate age. We know that we talk about age is a risk factor, risk factor. The fact that you're not older than 55 doesn't mean that you cannot have heart disease. And that's why the younger you are when you present with a cardiac problem, the higher the chances that you're gonna be missed. Because they assume that you cannot have heart disease because you're too young. So the same for our sisters or our daughters, for you, your family members. Like, if you think there's something wrong, keep insisting until somebody finds what is wrong and not going by, you're too young, you cannot be having problems, because that is what the people that we ended up burying. So compared to men, women are significantly less likely to receive medication when they go to the emergency room with a heart problem, and it is because we are not recognized properly. We need to get rid of that image. Remember that how the ladies, they were asked to show how their heart attack, and then they were all holding their chest? Well, a few months prior to when a woman presents with a heart attack, they're gonna start complaining that they're short of breath, that they get indigestion. You see how the lady on the show said it was more of I was nauseous, and they gave me medication for my stomach, and it wasn't getting any better. And when she was throwing up, that was already, she was having a heart attack. And she started early, weeks before, but nobody could say, oh, there's can be a cardiac problem there. So a month before, the study showed that at least a month before a woman presents with a heart attack, they're gonna start saying, I'm short of breath, I don't have enough energy, I get this indigestion, and it has nothing to do with eating. We get upper back pain, more between the shoulder blades, like a pressure in there that has nothing to do with lifting weight, or a discomfort in your neck or your jaw. Now, we can present with chest pain. Yes, we can. But nobody's gonna miss a chest pain. If you go to somebody, to your doctor, and you said, I'm having chest pain, the first thing that they're gonna think is your heart. Even if it's that you pull a muscle, the first thing that they're gonna think is your heart. But if you go to the doctor saying, I'm short of breath, they might not capture that you're having a heart problem. So it's gonna be again, you have to be your own advocate. Either somebody knows, and my hope is that as we continue being proactive in our community and educating not only our patients and our community, but our providers. So if you don't become your own advocate and you encounter a doctor like that patient that we just saw today, she said, I trusted my doctor. He said that I have reflux. And it's not to blame your doctor, but if they're not there for you, then you gotta think, you know what, it's not right. And then you gotta continue insisting until you find an answer. Otherwise, you're gonna become one of those statistics. So they call it atypical because it's not the typical presentation for men. And then more often than not, it's not only that we present differently, our worst outcomes is because we also fail to seek medical attention. And that is just directed to you, the woman in my audience. We always put ourselves last. And then you're taking care of your elderly parents, you're taking care of your kids, there's so many other things that you have to worry about that you put yourself last. And not only last in seeking medical attention, last of caring for yourself. Like you're not eating properly, you eat whatever, whenever you can, you're always on the go, you're not spending time to exercise, you're not spending time to meditate, you're not spending time to balance yourself. And then whenever you're sick, you find excuses. We find excuses whenever I have the opportunity to, we always have a story. Oh, I'm short of breath, but maybe it's because I'm fat. Well, did you just became fat overnight? Why are you short-bread now? No, so then we gotta think about it before we said, you know, if there's something that can kill me. Oh, well, I'm short of bread, but it's because I'm old. And we said, well, maybe you're deconditioned, but before we assume that it's because you're old, because heart disease, if you don't identify on time, you're going to have a bad outcome. So you wanna make sure that that life-threatening problem is not present before you assume that it's something else, okay? So, and then our vessels are a little different. And then sometimes what happens is that we have complained, we have mentioned something, you tell your doctor, they're not listening, and then you feel now like, oh, so I'm not gonna say anything else because I feel that it's my head, it's in my head. Is that in my head? And that is something that I never want you to go out there thinking, is that in my head? If you're thinking that that is in your head because your doctor doesn't understand what is happening with you, then it's time to go for another opinion before you assume that that's in your head. You know your body better than anybody. You know your body better than anybody. And nobody can tell you that the way you're feeling is right. Oh no. Okay, so then, going back to prevention. So I said that you don't know until you know, and that's part of my prevention motto. You don't know until you know. We all have a story where we have somebody that comes to you and said, you know what, well, do you remember so-and-so? He just dropped dead. He just came out of the doctor's office. They told him that everything was okay, and he died. And then I said, well, we all know that we all have to die. Like my mom says, Nitsa, we all have to die from something. And I said, Mom, I know that, but you need to take your statins. so we all have to die from something. So, and I know. But you know, when you die from a condition that is preventable 80% of the time, and we can do something to help you live a longer and healthy life, why not, no? So I said, looking at you, I cannot say, oh, you're good. And what happens so many times is that we're active and we feel good, and we said, I'm exercising and I'm good. You know, I don't have any problems. And I said, no, even the athletes drop dead running their marathons and doing their exercises. So how can you tell? So I said, there's always a minimum of evaluation that you should go through. At least have an EKG. Your doctor should at least have you walk on a treadmill if you can, to do a stress test. We have other modalities of stress tests if you cannot walk on a treadmill. The stress tests help to look at what happened, how did your heart handle the stress of the physical activity. What is your blood pressure when you're exercising? And then it also can help your doctor guide you if you're planning to get in a routine of exercise. So I show you here what I believe and what is recommended by the American College of Cardiology as part of the minimum evaluation that you should go if you want to know in what condition your heart is. Get an EKG, do a stress test, a calcium score, and a blood test. And the blood test will be to look at your cholesterol and your sugar. A calcium score, I love to call it the mammogram of the heart. You know, we don't have a mammogram for the heart. We go for mammogram every year to make sure we don't have breast cancer, but we don't know what's happening with our heart. So a calcium score is a very easy test. It's a CT scan. It goes around your heart. It looks at the arteries, specifically the arteries of your heart. Basically, it's gonna help your doctor to know if you already have plaque that started building up in there. Because if you do, then we can do something to prevent that plaque from becoming a problem for you, no? And based on that score, and your cholesterol number, and your inflammatory markers, and other markers that I mentioned earlier, then your doctor can sit down with you and say, your risk for heart attack or stroke in the next 5 years is this. This is what we're gonna do to help you change that. But if you don't know, then they'll probably be satisfied with, that cholesterol look good for you. And then good for me for what? No? So normally we use kind of like generic guidelines to say, okay, do you have high blood pressure? How old are you? And are you diabetic? To decide, you know, where your bad cholesterol should be, your LDL goal. Because I know that some of you had heard this from your doctors when they say your cholesterol is high, we gotta do something about it, no? And then we use risk. We use some we get an idea on your risk to decide where that LDL has to be. But there is no guessing when you have a calcium score. Calcium score helps us to directly say this is what we need to be. This is how much plaque you already have in those arteries, and then it gives you also information as a patient, awareness of, I already have disease that started beginning to form, what can I do to have power over this? Unfortunately, most of the insurances don't cover calcium score because it's a preventive test. And have you ever heard of insurances trying to prevent you from developing disease? They're there to supposedly pay when something is wrong with you, not before. But I hope that one day that, I don't know if I'm gonna live to see that. I always tell my daughter, I don't know if I'm gonna live to see this, but one day, we are gonna go to doctors to prevent getting sick. We're not gonna go to doctor to fix something. We're gonna go so they can check, make sure everything is okay, help us guide our diet, our lifestyle, and then the day that somebody gets sick, people are gonna look at them like, you haven't seen the doctor? How can you get sick and not know that you have a problem? But today is a reactive medicine. Average price for calcium score is about $90 to $100, so it's not actually very expensive when you think about what can give you. So, and then I said it's a fantastic tool, and sometimes you don't even need an order for that. If your doctor doesn't feel like that's something that you need and you want him to have it done, you can go to an imaging center and perhaps they can do that for you. Okay, so this is, I think that, I'll leave you with this. I think that everybody's life matter. I just feel that because of my passion for women heart disease and preventing heart disease, I think that we all deserve a beautiful opportunity to live healthy and long lives. And now I'm gonna end here so you can ask me all the questions. You go ahead.
How do you solve the problem of men stressing women?
Okay.
Did you say yes to you?
Yes.
Yes, Steve?
You're right.
So, so I understand that with the experience, as I have learned with my patients, she is right 90% of the time, and you're wrong 10% of the time. That's how you solve that person.
I think I'm wrong 100% of the time. She's right.
Bill, we're gonna ask Judy in 6 weeks if she carried through.
Yes, ask Judy that. Yes, ma'am.
The side effects of blood pressure meds, can one of them be anxiety?
Well, you know,
I'm
this
specifically talking about amyloidosis.
okay. So there is unfortunately, as you know, as we take a pharmacological agent to alter something in our body, there's always gonna be altering other stuff in our body. But if you had the sensation of anxiety, and I never said no, not a potential side effect, even if you look in the book and you find that there's nothing that said that the medication causes anxiety, for example, in your case, although amlodipine can cause a little bit of anxiety. But I will explain why. Everybody is their own body and their own universe. And if somebody come to me and said, I'm having this problem with this medication, and I cannot find anywhere in the planet where that medication caused that, but if for you it's doing it, what was doing it for you? What can we do? Of course, we get it to give you the benefit of the doubt. The medication is causing that problem, so let's try to find another problem. The problem is when you're not willing to work with your lifestyle, and now we rely on medication, and now the limitations is because you're gonna be developing side effects to everything. So once you start developing side effects to everything, we said don't regulate it. But amlodipine as it drops the blood pressure, it can cause a little bit of tachycardia, and then that tachycardia can make you have a feeling that you're having anxiety. But also we know that sometimes it's not the active ingredient of the tablet that causes the potential side effects, as it is the inactive compounds that they use to create that tablet. Sometimes it's that. Sometimes I do have patients that they cannot take the yellow pill of that medication, but they can take the white. And basically what happened is the pharmaceuticals are using different compounds. There are the inactive compounds. So those sometimes can create allergic reaction to patients that they don't realize that it's not specifically the drug as it is inactive compounds. But to answer your question, yes. So if that is a problem that you've been experiencing, then you'll have to discuss with your doctor what other alternative for you.
Yeah, my imagination.
Oh, that's what it said? That's what I mean. That's what I mean. It is your body. So, and that's what I mean. And then you don't have to stop there.
It's not one of the side effects of that. How about the sugar?
Well, lisinopril is, I don't have in front of me all the potential side effects of the drug, because those are drugs that we prescribe very commonly. We kind of familiarize ourselves with the most common side effects. But, like for example, lisinopril, we know it's gonna cause cough more often than not, rather than making you feel anxious. But, so that is, if you're taking, now you're talking about 2 different blood pressure medications. So they already have you in 2 different medications. So if you have problems with the 2 of them, they're gonna need to add 2 more and move those 2, or change to this, or change to that. And then it's kind of like trying to find with you and your body, what your body be able to tolerate. But then you need that provider that is willing to work with you to try to find the right medication for you.
Do you do that?
Yes, but then one day I'm gonna tell, what is your name?
Jerry.
One day I'm gonna be like, Jerry, this is the pill, okay? But yes, absolutely. Any other questions here?
I've been testing my blood pressure every day, and I've noticed in the last 2 or 3 weeks, sometimes my pulse rate is 27 or 31, and that seems, I don't know why it's so low. Is that something to be concerned about?
Well, there's a few potential explanations to that. The answer to 27, 30, is that something to worry about? Absolutely. Because if that is real, that your pulse, and that's the part, is that real? That's the first thing. Because if that is real, your body needs a specific amount of blood per minute to be able to function properly. Your body needs that oxygen delivered, it needs the nutrients delivered, and when your heart beats at 20 beats per minute, it's barely getting anything. We know that average, we're looking for 60 to 80 beats per minute when we're resting. So especially if you're not taking any medication, because sometimes we use medications that lower the pulse a little bit. But, so 20 is, you're gonna end up with organ damage. And then you're gonna end up passing out, your brain is not receiving enough blood perfusion. If you feel okay with that, chances are that it's your electric machine that is giving you an error. And normally when that happens is because you have an extra beat that the machine cannot capture, or we need a very stable pulse for your machine to be able to accurately calculate or estimate that heart rate. And if you don't have that because you're having extra beats, then your machine is not gonna do that. So if you start seeing that, the best thing to do is to notify your doctor so they can have you perhaps wear a monitor.
I did wear a monitor for 2 weeks, and then they read the monitor and said I was in constant AFib with no break.
So when you have atrial fibrillation, those machines, the blood pressure machines, or the pulse oximeters are not as reliable for pulse. AFib is the typical one because it's erratic. And the machines, they have their limitations, as good as the engineer can develop a software to set, but they normally need a very specific steady pulse to be able to calculate. So normally patients start noticing error in their machines or the heart beating, giving crazy stuff, and that is a warning that something is wrong with the rhythm. And you did the proper thing, which is, let me get checked.
I was also told because of the AFib, I've had a stroke because of it. So they told me to walk every day, but not to stroll and not to rush, because either I want to protect my heart, I want to strengthen my heart. And I said, you don't want to do too much aerobic, and you don't want to be, just strolling and not getting exercise.
So is that as specific as it got for you? You don't wanna do too much, you don't wanna do too little? And you're like, let's get a little more specific here. What can I do? I don't wanna speak for your condition in particular because I don't know what else beyond the AFib is. And I don't expect that you're gonna share with us all your cardiac health. But there's no restriction to physical activity unless you're having problem controlling your pulse. When it comes to your activity, the only limitation with aerobic, I'm talking aerobic, is going to be that there is something that they're having a hard time controlling your pulse, so they don't want you to go too fast. But other than that, there shouldn't. So the easy way for you to know that you're not doing too much or not doing too little, I tell my patients when we walk together, I walk the second Saturday every month, Sharon Moore's building, with everybody that wants to come. And that's called Walk with the Dog. We meet there at 7:30. Normally what I tell them, so they know that they're doing a good exercise, I said, make sure that you cannot sing I'm not expecting to be a good singer. They say, what if I'm not a good singer? If you can sing a song while you're walking too slow. But you're walking too slow.
Oh,
If you can sing a song, you're walking too slow. But if you cannot talk, you're walking too fast. You have to be able to carry a conversation when you're walking, and that is a moderate brisk walk. So try singing, and you say, oh, I can sing. And then you say, can you talk? And you're like, oh, I can talk. Okay, so I'm not walking fast enough. So then I had to go a little faster than this, and then keep doing that test until you find that place where I can talk, but I cannot sing.
Should you add distance also, or just pace?
Well, time, remember? I said 30 minutes at least. So if that distance is whatever you can cover in that amount, because not everybody has the same stamina or the conditioning to walk a mile in 10 minutes is running basically. So 15, 16 minutes is what I see is average when I walk with my patients. Normally, if we walk 30 minutes, we can accomplish 1.8 to 2 miles. So it's kind of like around 15 minutes miles. So you probably be covering almost 2 miles if you walk that fast, but go by time first for you. Go by time.
I walk about 20 minutes and I cover about a mile, 0.3.
That's actually a good pace. I have a question back there.
Can you specifically address, you particularly as a cardiologist, as well as your profession in cardiology, how they integrate holistic medicine, be it herbal or supplementation, vitamins and or minerals, and the lack of use of niacin in regard to heart disease?
Well, I cannot speak for everybody, but, and I know that, and it's not the doctor's fault. You know, when we are trained in medicine, they just train you into, you know, you gotta be in this way, and it's all about, especially if you're an MD. If we are MDs, we get trained into, this is the disease, this is how you treat the disease, and this is how you go, you know? And then it's up to the provider how you're gonna incorporate, you know, the mind and food and the proper nutrients. As a cardiologist, I'm very well aware that we can heal a lot of our cardiac problems. I used to say that 80% of the time is preventable with the proper nutrients. For example, atrial fibrillation, not that I'm saying that atrial fibrillation is reversible all the time. Rhythm disturbances, PVCs, palpitations, more often than not, there's an imbalance in your electrolytes. Like magnesium is low, you know, and then normally we focus a lot on the electrolytes that we can measure on the standard lab. But again, going back to, are you willing to put a price on your life? Because if you come to me and that happens, and there is symptoms that we cannot explain, or we're trying to look into your micronutrients and your minerals and looking at your chromium levels and see if there is an imbalance in there, insurances are not interested in covering for that. So it's a little challenging unless you find a doctor that is interested in doing it, and then you have interest enough to go through the test, and even your insurance don't cover. But I like to incorporate food as part of that. That's why I mention always, we talk about vitamin K, how important it is to help prevent atherosclerosis, and normally we talk about the green leafy vegetables, and you know, not sometimes we talk about vitamin K supplementation, but if you're gonna take vitamin K, you gotta make sure that you're not taking Coumadin, because if you are, then your doctor you need to talk to them, because it's gonna interact with your medication. So again, it's just an open conversation with your providers. I take tons of vitamins. So here, you're never gonna be wrong with talking about supplements and vitamins. But actually, even my staff member, they laugh because they said, did you finish your supplements? I carry them on my pocket, you know, my omega-3, my nutrients, my vitamin B complex, because we know that vitamin B is homocysteine. But it's always gonna be up to you to how are you going to present your doctor that you believe in that, and if they are into it, they will help you through it. And that's why I said never settle for it, for something that you don't feel is in your best interest. You know, there's a lot of doctors in this area, and a lot of doctors in the country in general. So if you're with one that doesn't believe in what you want, then you're not aligning, and then that's gonna be a problem in general, no? I'm gonna give you another example. There is a lot of studies that have been done in grounding and pulse magnetic fields, there's books that have been published in cardiology. Actually, there is a very well-renowned Dr. Sinatra. I'm pretty sure you guys know Dr. Sinatra. Dr. Sinatra actually became very famous, and he's been a lot into holistic and alternative medicine, but we believe, I am like him, I believe that we can incorporate both, that they're not mutually exclusive, that we can work together. Ideally, if you can move a patient from taking pills to just be here in a natural way is the ideal, but it requires effort. And if the individual is not interested in doing that, then it's hard to get there. And then it comes to your doctor's point of, how can I not jeopardize your life if we cannot work in this area, no? But grounding is an amazing thing. Walking barefooted in the grass, because we know that all these sun rays and storm where they're happening around us, and then that gets into the earth, and then when you ground, it helps to release some of that energy. There is a company called Heart Math. I don't know if you guys have heard of it, and they are scientifically proven. It's a lot about how respirations can help our heart and rhythm. Specific type of respiration, how can you get congruent with have a congruent heart rhythm when you're worrying about stuff? How do you breathe? How do you go in a gratitude mode? How do you find something to be grateful for and take deep breath, and that helps your heart relax? So there is so much into it. But if you ask me, particularly, I do agree that we underestimate the power of nutrients, especially, or supplements, especially magnesium. Magnesium, we have in our community, our country, very low magnesium levels because we don't have food that is rich in magnesium. Is because of the alterations that are happening in our food. And then the majority of our population take antacid medication, and antacids prevent the ability of the body from absorbing the little magnesium that you put into the system, because they need an acidic environment. So now you put an antacid in your body, and then your body doesn't absorb magnesium, your magnesium gets low, then you start having cramps, you start having palpitations, and then they're looking for what is causing that. It's just your magnesium is a little low. Or your potassium is low, and they don't understand why your potassium is low, because your magnesium is low. So you look at your magnesium, they're gonna find out why your potassium is low. Niacin is a fantastic vitamin, no? It's great. We gotta be careful because it can affect the liver. Depends on how much do you take of that niacin. Reggie rice, for example, for management of cholesterol, when patients need a little bit of hint of that cholesterol management, but they don't wanna take statins. Omega-3 is a fantastic supplement. And you know what is the sad part? We, for decades, knew that omega-3 is a great supplement to lower your cholesterol and to raise, and to help with your inflammation. Lowers your inflammation. It's good for your brain health.
What is it?
Omega-3 fish oil, no? You can get it from krill oil, you can get it from algae, because the reason why fish is so rich in omega-3 is because they eat algae, and the krill eat algae, so. If you're vegetarian and you don't want to take omega-3 or fish oil or krill oil, then you can just go ahead and get algae. But omega-3 for decades we know is amazing. And then, you know, because in medicine everything goes into randomized controlled trial, let's try. It doesn't show that it reduces your chances of having a heart attack. And so it was kind of like basically poo-poo by for so many decades. And now, 2 years, or 3 years ago, I think it was 2 years ago, there's a new study that came and said omega-3 is good for you. But it had to be specifically this one that this company made. And I'm like, oh really, what are the odds that is specifically that one that company made? And then, you know, it's coming from the cardiologists, and you know how we are kind of like so into like it has to be like that. The study said, well, the fish oil that we and that was actually Vascepa, so I can mention that. The drug that was, the company that actually was able to get that omega-3 and a specific concentration on DHA and EPA is Vascepa. So if you get a managed triglycerides, it's very good for lowering triglycerides and lowering your LDL. It has to be Vascepa, really? So now because we have a pharmacological company that decides to extract that omega-3.
How do you spell that?
VAS, V as in Victor, AS, CEPA. So it will be good if you don't want to pay for your omega-3 and your insurance, you want your insurance to pay for it, then that will be the omega-3. However, because it's expensive, your insurance might not want to pay for it. Yes,
All
sir.
supplements created equal?
No,
No.
no. That's actually another, and I think that actually when we get there is the reason why in medicine, because we like to be able to standardize things. And that's what I said, I don't blame, because in the scientific world, we like to prove that this is going to work like this in this specific environment when you apply. But then now, if you are taking supplements are not a industry that is controlled. So there is so many companies that are developing these supplements. So then now you gotta trust a provider or somebody that is knowledgeable on the purity of the product that you're buying. So you gotta make sure that you are using pharmaceutical grade supplements, because they go through more scrutiny in terms of byproducts in those supplements, or things that you don't want in there, because the other ones, you know, and it's just hard, because you just grab something, you don't even know what is the amount of really of that substance that is in there, so you wanna make sure that you're using pharmaceutical grade supplements. So if you're buying it from your health food store, make sure that you consult with somebody there. They're very, very good. Actually, Jean used to work at health food, and she is amazing giving those advices. And I think that, you know, it's more, you agree that it's more about the knowledge and what is the degree.
Well, there are a few companies that are pretty well known that,
Take your mask down so we can hear you well.
there are a few companies that are pretty well known, and their formulations are based on years of using the research in Europe. So it's not like they just came up with it yesterday, so there's a backing behind it, so you can trust them a little bit more.
Yes.
Honestly, when you buy things at like Walmart or even like CVS, look at the ingredients. Some of the ingredients in there, you'd be like, what?
Yes.
And if you see that, don't buy it.
Yeah, if you cannot read it, like, you know what they said, if you cannot read the ingredient, don't, if you don't know what the ingredient is, just don't get it, because like, what is this? So basically is discussing with a provider that, when I recommend supplements, I tell my patients specifically which one to get, because I am very mindful of that. And how do I prove them that they're good quality and what is happening for them is when we check their labs. You know how so many times you take supplements and you're like, is this doing something for me? Like, is it really doing something for me? So when you see how is that impacting your labs, then it gives you an idea that I'm absorbing this properly, I'm getting the right amount. But I'm glad that you brought that in, because not all supplements are created equal.
You mentioned your mother takes statins. What do you know, we've heard that you've been taking statins forever, but heart disease doesn't go down. So how good are statins?
Well, remember that cholesterol is one risk factor. So if we are going to say, well, statins don't reduce the risk for heart disease, which they do. If the statins are not helping us to lower the incidence of heart disease, then why are we taking statins for it? I think that it's unfair to make that statement, no, because it's just one risk factor. So basically, you're trying to prevent one, and I do, and I'm glad that I mentioned the example of my mom, because with my mom, I tried lifestyle, I tried diet, I tried omega-3, and then I said, okay, we're gonna try your niacin and Reggie rice. So we went through a lot of stuff before we got there, and of course, we also had to know why are we using the medication, what is our goal, for example, no? If you don't have diabetes, you don't have coronary artery disease, you don't have high blood pressure, your risk factors for heart disease are very low, then do you really need statins? Can we work with other stuff? There are fibrates, there are fiber, there are many other things that we can use. Especially if your doctor understands from where your cholesterol is coming. I think that's actually very important, which I try to make sure that in all my patients I know, especially if their cholesterol is not properly controlled. Sometimes it's not because they are absorbing cholesterol as it is because they're producing too much cholesterol, the liver is doing it. It's a little harder to manage production of cholesterol with your lifestyle. So sometimes we gotta go to the statins, especially like for my mom. Her mom had a heart attack when she was 42. She has a sister with stents, and I'm like, Mom, your cholesterol needs to be below 70, and you're not bringing it there with your lifestyle. So can we eliminate that risk factor? Let's try this. So it's a conversation. What are my risks? Why am I taking statins? And I know that statins are those drugs that more often than not, the doctors are just writing for them. You go there, your cholesterol is a little bit high, they're like, here, it's a statin. Whoa, is there anything else that we can do before we get there? So normally when I get there, I have worked with my patients and they know. I'm like, we're there. Unless you already have open heart surgery or you already have stents, then I'm gonna explain to you why. Let's try this because it's important. But and this is not because I'm giving you this speech, but my philosophy is, I'm here to facilitate your care. I can give you all the advice that you want. I wanna make sure that you have the knowledge. That's why I'm sharing this with you. And that when you're gonna make the decision, you have the right information. It's not that you worry about stuff that it doesn't have real data. And once I clarify that in your head, and you're very clear, and you still make the decision that you're not gonna do it, I respect that. Because it's you, it's your body, and we have to respect that. I'm here as a guide for you, but I cannot force you to do anything. You're welcome.
Do you require a referral?
No. You have a question?
Yes, if you're not having a problem, does the doctor ever order an EKG or stress test or anything? Do you ever have that?
Well, that's what I'm saying, that you have to be your own advocate. Because so many times you go, they will check some labs and they say, you're good. And, I do have, this is a great example. Probably a few months ago, I had a couple that they came together to establish with me. They're kind of like 3 years apart in age. And her husband had 3 stress tests. He has his echo, he has his labs, everything. He doesn't have coronary artery disease, but the doctor has been giving tests to make sure he's okay. The wife never had a stress test. And they were seeing the same doctor. And then she said, I asked him for a stress test and he said I didn't need it. So, if I said, these are your risks, at your age, you should have at least this minimum evaluation, then if your doctor hasn't offered that to you, you're going to request it because you're gonna be your own advocate. And you're gonna say, I wanna know a little more about my heart health. I don't know much about my heart health. You know about your mammograms and you don't? Yes, so then that's part of it.
The Tri-County Heart Institute, is it strictly heart, or do they have other modalities?
That's me, baby. I am Tri-County.
It's not a group of physicians?
No, it's me.
Okay.
Yes, it's all cardiac, yes.
I want to say something that's very important. I have a friend who was my fiance. That's a long story.
He stressed her too much.
That's for real. I listened to your advice. He was being killed by 2 doctors here in the hospital who mismanaged him for 16 years. And he was dying. And she was called in and she saved his life. And she cared. I had a great cardiologist years ago. I moved around. I never found a cardiologist that knew what they were talking about and listened to me. She listens. She absolutely listens. And I had her speak at a women's event. And Mary was one of the guests. And Mary said, I need her phone number. If you go, I'm going. And I have recommended her, and there is not one person that I have sent to her that has had a complaint at all. But for her to save a life was worth every word that I can say about her and her practice and her philosophy and her caring. She cared. And she's not paying me, and I still have to pay her for that. This was not a paid advertisement.
But I think that's more important, and I really appreciate those words. My practice is, I treat my patients like they're my family. And, but it doesn't have to be me. I just want you to have a good relationship with your doctor. If you have a doctor that listens to you, if you have a doctor that you feel that you can communicate with them, that they're receptive to what you have to say, you are in the right place. But if you feel that you're not hurt, if you feel that you have to insist too much, you feel that you are still not at your optimal health, then seek your care somewhere else. So it's just about your relationship with your doctor. Your relationship with your doctor should be as important as your relationship with your spouse, because they're there for you to make sure that you're living healthy. You go ahead, Laura.
Are you doing any research or studies at this point?
Right now, no. We finished the research with the cholesterol, which I don't know if you guys know about that. Cholesterol was that powder that the Gatorade inventor created for cholesterol. So I got involved because we're doing the research with them, and I wanted to get the woman in the research, as you know. We're trying to start working with another research, but that one is very particular. It's called the Watchman Research for Women. And Watchman is this little filter that goes into the heart for patients that have AFib that doesn't want to take blood thinners. We're developing some of that. We just finished the Warrior, which was with the Chance Hospital, and that was about microvascular angina for women. But right now, at this moment, there's no research going. We're working on the Watchman. The new book, understand your food. It's about understanding what you eat and how does that affect your body. I don't know it's gonna be a lot about digestion. It's all gonna be, remember, I'm a cardiologist now. So I'm gonna be focusing on what do you do to help it's more to, I was just telling Linda, it's not for lack of information. It's because of how so confusing it is. So it's more about how can I help help my patients understand, and anybody that wanted to read the book. Like when I wrote Guilt versus Diets, I said, somebody asked me, how many books do you want to sell? And I said, one life I want to save. And this is already paid off. We have at least 10 women that have come to me, see me, or 2 of them went to see the doctor because mom lived here and they said, you gotta read this. And they had severe cardiac problems and otherwise they wouldn't know. And I said, it's paid off. Doesn't matter if I don't sell any other book, it's paid off. So the same thing with that book. It's more about helping my patients understand what they eat, how can they heal their body with what they're eating, and how can we get in a path of health. If you go to Barnes & Noble, there's like 500 books about eating and diet. So it's more to, can I do something to facilitate it for you when it comes to thinking about your cardiac health? Then that's what the book's about.
Dr. The good magnesium levels that you recommend?
Well, if you don't have any problems, like no palpitations, no cramps, no cardiac problems, then it normally between 2.2, 2.3 is a good level. For my patients that have palpitations or problems with rhythm, I try to keep it around 2.5.
You're saying 2.5 micrograms?
Are you talking about amount to take or levels in the blood?
Amount to take.
Oh no, amount to take 200 milligrams. But you want to get your levels checked. Because what I was just telling now was levels. If your levels are below 2.2, they're low. But normally it comes in hundreds, so you can have, normally a good amount for a day is 200 milligrams. Now, disclaimer on the magnesium. Do I still have a minute? Disclaimer on the magnesium. It has to look, you have to make sure what type of magnesium you're taking. Because magnesium citrate is what we use for enemas. So if you're gonna get magnesium citrate, it's gonna make you go. So if you have a problem with constipation, that might be the perfect supplement for you. Because then it's gonna be supplementing your magnesium and helping you with your gastrointestinal transit. Magnesium oxide, on the other hand, doesn't cause diarrhea. It's great to support your system, and it also helps with your gastrointestinal system, but not causing diarrhea. Yes, sir.
Magnesium malate.
That is actually perfect too. Yes, malate. There's a lot of forms of magnesium, but I just want to warn you about citrate, because then I don't want you buying citrate and then say, Dr. Alvarez, look what you gave me.
I give them time to come back here.
Yes, go ahead, sir.
I mean, sometimes a doctor prescribes medicine and you go home and it says side effects, this and this and this and this, and the last side effect is you may die. And I mean, why would you accept something like this?
Well, there are disclaimers that had to happen, but you also need to measure risks and benefits. and the potential that I might develop a problem with this versus what is it that we're trying to do with this. So everything in life carry risk. Why would you drive a car if you know that you can have an accident? So that doesn't mean that you're gonna have an accident, but you might, but you still take your chances. So when your doctor is recommending a medication to you that have potential side effects, of course it's the responsibility to tell you these are the potential side effects. And I think that that's one of the secrets to adherence to therapy. If you know that niacin is gonna give you flushing, and I tell you that it's gonna make you flush, when you flush, you don't go crazy thinking that you're gonna die, and then stop taking the niacin because I already told you it was gonna give you that. So if you already know and understand some of the potential side effects, then it makes it easier for you to accept it. But not always we're gonna be able to go through all that list of the potential side effects. But if your doctor is giving it to you and you already went through the conversation of why, because the other issue is when you get a pill and you don't even know why you're taking that. But if you already understand why, that's when you say, okay, I'm gonna drive the car knowing that I might have an accident, I'm gonna take this pill because it's gonna help with this, that potentially can cause that if I don't control, versus I might develop a problem. Does that make sense?
Makes total sense.
One more question.
One more question. Who is gonna be that taker?
There is a test out there that, and I can't think of the name of it right now off the top of my head, but it's a blood test that will tell you how you metabolize the medications. And I believe that Medicare is paying for it now.
It's not a blood test, it's a swab.
Oh, is it swab? Okay, yeah, swab.
Swap?
But it tells you how you metabolize certain medications. And it will tell you that you metabolize this one really fast, that one really fast, whatever. And it also sort of tells you the potential reaction that you might have because of your, genetics.
So as we are moving more into individualized medicine, which is what we're trying to do, is like everybody is different. No, not, again, even look at where we are in baby steps. I'm saying, women are not little men. Why are we using these drugs that we're testing in men, but we're not testing in us? Like statins is the best example. Women don't tolerate statins very well. We're not good metabolizers of statins, but then they're given to us like we are another person, like the ones that were in the research. But the more we go into individualized medicine, the idea that we create a map based on your genome of what medications you're gonna respond better, what medications you're not gonna do well with them. And although there are some companies that run those tests, they are not, they're not all inclusive. So it will be more of a what are we looking for. And if you're referring to that test that, I think I had 2 patients that came with that paper for me to sign. And that one is very simple. It doesn't include a lot of stuff. It's more like a genetic thing and see if you have, for example, if you statin metabolizer, which I always like to do that as well, because that's part of the advanced lipid panel. You wanna know you metabolize statins properly, because otherwise we know that that's a potential problem for you. So there's a few things that are included on that test. I don't know exactly what is it because I haven't stopped to look at it, but that is going to start happening, but it's gonna take decades until we get there. So if you feel that there is a potential problem with the medication that you're taking, then your doctor will have to do particularly for that drug. And most of the insurance are not gonna cover that, so you gotta be your own advocate there, absolutely.
You know what? I think this is a standing ovation. Do y'all?
Oh,